This is Gwen Carden, and I have with me again today Rehana Webster from Perth, Australia. Hi, Rehana.
Hi there, Gwen.
Good to see you again.
Same here.
Rehana, as you may know if you saw the first segment, is a master EFT provider, and she runs a clinic for people who have addiction problems as well as emotional problems. And last time we got her to talk about what EFT is. And Rehana, one of the things that you said that intrigued me, you used the term pattern interrupt. And I wonder what a pattern is, what a pattern interrupt is, and what that has to do with EFT.
Pattern interrupt is a learned response. So it was something that was learned probably in childhood to respond to a certain stimulus in the environment. And then as we grow older, we just keep responding to a stimulus in the environment, whether it's a threat or not.
What would be an example of a childhood pattern?
If a child was brought up with a parent that shouted a lot, they learned that shouting meant that there was some trouble, and that the child had to then lay low and not be in the way. So whenever that happens in adulthood, the adult will then shy away from loud noises or loud voices and tend to kind of withdraw into their shell, even though it might not be a threat. The loud voice might not be a threat, but it's a learned response. So they just respond like that. It's like Pavlovian conditioning, Gwen. If you remember, Pavlov did those experiments, with his dogs. Ring the bell, salivate, ring the bell, salivate. So what's happening is that a child who's learned how to get out of the way because there's a loud noise, a parent is shouting, then that child will continue to probably do that in adulthood, even though there is no threat.
What does that have to do with addiction?
It could be that some trauma was experienced in childhood, and then the child learned to mask the symptoms of the trauma by self-medicating, which is maybe alcohol or drugs, because what happens is that alcohol and drugs will alleviate the symptoms of anxiety, but unless the core experience is worked on or interrupted, the response will be the same, and the adult will continue to self-medicate and to take away those negative feelings.
So let me see if I understand this correctly. You maybe as a child, grew up in a household where the father screamed a lot, and that scared you, that caused you to want to withdraw. And as you got older, when you would get in an environment where you would experience a similar kind of fear response, you might turn to a substance.
Absolutely, Gwen, you're right on the nose with that. And then the substance would be a masking of the fear response. It will not take it away, but it will just make the person feel better temporarily.
And so EFT does something to interfere with this pattern that you're talking about?
That's right. It's a neurological pattern. When there's a trigger in the environment, the response is for the brain to produce certain neurotransmitters that tell the body to act in a certain way. For instance, adrenaline, it'll give the body a hit of adrenaline, and the person gets ready for the fight, fight, freeze response. And this EFT actually will interrupt that pattern with the brain. Within nanoseconds, the brain talking to the body, and it'll stop the flow of those neurotransmitters from the brain to the body, and therefore that fear won't be felt by the person. So that's the pattern interrupt.
So it's actually retraining the brain. When you say you're interrupting the pattern, you're actually growing some new neurons, maybe a different way of responding to the same feeling?
That's absolutely right, Gwen. It's reprogramming the brain. It's allowing the brain to find new ways of responding to the old stimulus that is no longer a threat. And so there's actually some changes in the neurology, and research shows that already that with EFT, the use of EFT, the brain actually starts to change in many ways. You've heard of the plasticity of the brain, and now, we thought that the brain was hardwired into responding in certain ways, but now we know that all that is changeable. And EFT is one of the best self-help ways of changing the brain.
Wow, that's fascinating, and we have got to talk about that in our next segment. I want to know more about that. Unfortunately, we are out of time. I want to encourage anyone who enjoyed this video to please press the like button at the bottom left side of the screen. We also would like for you to return on a regular basis to the website for a lot of great information, current updates of what's going on in the field of addiction, and we will be posting another video of Rehana and her great information very, very shortly. So we will continue this in another discussion, and I want to thank you, Rehana, very much, and we will see everybody back here very soon. Thanks a lot. Bye.
Thank you. Thank you, Gwen. Bye-bye.
Bye.